get started.
Hey, they're great. They're
faces.
finally moved out of there.
Okay.
Central Oregon about 6 years ago, so yeah, never made it to Seattle, but
So welcome everyone as we get started.
yeah.
We have John Adams' presentation out front. We'll get started a little bit. Do a couple things before we start out. First off, what I'd like to do is something that we've done all the time, each meeting, especially since we have some new faces. Have everybody introduce themselves and what their roles are. Christy, let's start with you.
I'm Christy Albertson, and I'm the new grant writer here.
Sheree Morgan, Lakeview Gardens, and Lake County Senior Center.
Larry Coulter, I'm the administrative training for Lakeview Gardens.
John Adams, Eastern Oregon Healthy Living Alliance.
Mindy Bentley, Advantage Dental.
Rochelle Hanson, Food Corps Service Member.
Jimmy Hall, Lake County Examiner.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Dan Schwan's, Greater Oregon Behavioral Health and primary and non-emergent medical transportation and rental assistance.
Beth Hadley, Lake County Public Health.
Jamie Davis, Oregon State University.
Cecilia Montgomery, Hospital Auxiliary, and and whatever.
Diane Clay, now you got me stuttering. Hospital Auxiliary and interested member.
I'm Arvind Singh, I'm the CHIP coordinator.
Jen Mantle with the hospital.
For those that don't know me, I'm Charlie Twait, I'm the hospital CEO. So glad everybody's here. Thank you very much for coming. We're very happy to have our vendor here. You know, we keep the class of CHIP coordinators, keeping John still coming. We haven't quite gotten Mira to come back yet for a visit, but our vendor, we're excited about him getting up and running quickly, and there's a lot going on. So we're excited to have him. First off, do we have any comments that are not on the agenda from the general public? Any comments anybody needs to make about their? Oh, is anybody on the phone? Sometimes we have that happen. So, good. Andrew, do you want to introduce yourself?
Sure. Andrea with the Senior Center.
Perfect.
Little
Hello,
spot right there.
I
I'm
didn't want to
Ginger
catch you with
Casto.
your mouth.
I'm Ginger Casto from South Central Oregon Economic Development District.
Excellent. And we have another new guest, or not guest. Will, you want to introduce yourself?
Okay, Health Superintendent, Lake County School District 7.
Thank you. Again, welcome everybody. It's always great to have a lot of them. You know what, we'll just let it introduce themselves as they keep coming in. As you come in late, you're the last ones to introduce yourself, so you get to do that. First.
Yeah.
I'm Noni Moss, Senior Navigator at the Senior Center.
Excellent.
I'm Darwin Johnson, Planning Director for the county, also a town councilor currently.
Marvelous, thank you. We do have a sign-in list that's going around, so if you haven't signed up, please do.
We'll go this way first then.
So as we get our year started, and this is what, the second day of school, there's lots going on, and of course we have an exciting new year if you look at it from the school year standpoint. First off, we have sent out minutes. You probably haven't had a chance to read them. If you would want to take a few minutes and look at them, sorry we were a little tardy in getting them out to everyone. Does everyone have a copy? Anyone want to see a copy?
Just had a typo correction, Charlie.
We appreciate all the corrections.
It's just the Eastern Oregon Healthy Living Alliance, EOHLA. And it's in the title and then in the narrative. Second page.
That was my fault.
I'll fix it.
No problem.
Thank you, we appreciate all suggestions. Once again, Jimmy, we want to appreciate you for the stories that you're writing and the press that this group is getting. It's really good to get out as we try to find ways to improve the health of our community. So we appreciate it. Welcome. So do we have any other comments about the minutes, or if you haven't had a chance to read them? Whenever anybody's ready, I'd be happy to entertain them. Yes?
I'll make a motion that we accept the minutes as corrected, please.
Excellent. Do we have a second?
I'll second.
Excellent, thank you. It's been moved and second. All in favor, please signify by saying aye.
Aye.
Any opposed? Same sign. Great. Approve those minutes. Let's start off with Dan. Dan, you've got a lot of exciting things to tell us about, and we really appreciate that.
So for those of you that came in late, I have handouts up here.
I knocked them out.
Okay, good. All right, just want to make sure everybody has handouts. So my name is Dan Schwanz, and I'm relatively new with Gobi. My prior employment to Gobi was with Mid-Columbia Council of Governments in the Dalles, and our role was to be the Medicaid transportation brokerage for this area. We started working with Lake County and some other counties in July, I believe, of 2014, when Eastern Oregon CCO took on the transportation benefit. So I'm going to talk a little bit about that, and I'm also going to talk a little bit about the rental assistance program, and certainly will be happy to take questions. Some of you may not know what non-emergent medical transportation is. What it is it's a part of the benefit that the individual receives through the CCO or through the state, and Lake County is unique in that, so I'll touch on that in a minute too. And a person who can't get to their medical or behavioral health or dental appointments can request transportation through the brokerage. And I'll go into a lot of detail on how that works, but Lake County is unique in that when the CCO took over the Medicaid transportation benefit, the service area that Eastern Oregon had 3 different brokerages that were involved with providing those services. So for Lake County, it was TransLink and Medford. And in this particular case, they chose to retain the fee-for-service brokerage portion of the service. So if any of you in your professional work are dealing with individuals who need transportation that are not part of the CCO, they still would need to contact the brokerage in Medford. So this is the only county I get to say that. Everywhere else, when McCog took over, the other brokerage said, we don't want to do the fee-for-service at this point. It just is duplication of effort and doesn't make sense. So, but Lake County is a little different in that regard. So just want to make sure you understand that, because again, it is unique and different. So transportation is basically available for covered services. So that's basically services that are billed to the CCO, and that basically is then allowed transportation. So when someone contacts the brokerage to request transportation, they're going to determine A, are they a member of the CCO? B, is the service that they're going to cover? And if the answer to those 2 questions is yes, then the brokerage is responsible for finding transportation for the individual. No local numbers here, so I won't worry about that. But basically, there's a toll-free number, and again, it's easy to contact the brokerage. One of the things that the brokerage is required to do is answer the phone in a very short period of time. And they've been basically, on average, answering the phone within 30 seconds of the call coming in. So they're pretty fast. So generally, a person's not going to see the phone ring and ring and ring. Rides can be scheduled for any time, so Monday through Sunday, 24/7. just need to make those requests in advance. That's the key thing there. So again, particularly if the ride is outside of a normal type of a work day, the more advance notice the brokerage gets, the better. You want, again, to be able to give them the opportunity to find a provider to provide that ride. And in Lake County, and I'll pick on Andrew, just tiny, tiny little itty bitty bit here. So Lake County is one of the counties where the brokerage doesn't actually have a current existing provider that's based in the county. Andrea for the senior center at some point is gonna be a provider for the brokerage, and that will enable the brokerage to respond to shorter notice type requests a little easier, but right now the brokerage uses primarily a provider that's based out of Klamath Falls. So in order to provide service in North Lake County, the provider has to schedule enough time to get to Christmas Valley, to get to Lakeview. So again, the more advance notice you can give the brokerage, the better. Again, once hopefully we've got a provider in the county, that may improve that opportunity a little bit better, particularly if she's already doing something where she's transporting, let's say, someone from North County to South County or vice versa. So again, it'd be easier to be able to piggyback on other rides. And then if a person's not gonna go, canceling with the brokerage is just like those of you that are in the medical profession or the dental profession. When people don't cancel their appointments and don't show up, that costs you money. It also costs the broker money, it costs the provider money, because the provider doesn't get paid when they go to do the transport and the person's not there or not willing to go. So again, if you're dealing with individuals that use the service, please encourage them to cancel as soon as they know they're not gonna go. Because again, it ultimately increases costs, and at some point, some providers may say, we're just simply not gonna provide services to this individual any longer, simply because they're never there when we go, and we don't get paid, and that's not a particularly winning business proposition. So, encourage people to do that. We use primarily in this area two major types of transportation. Again, local providers out of the Klamath Falls area, and also what's called the mileage reimbursement program. So people who have access to a vehicle or have friends or neighbors or family that are willing to drive them, the brokerage can provide mileage reimbursement to that individual. And that's, again, about half of the transportation that's provided in Lake County is done in that way. And the current rate is not real good, but it's 25 cents a mile. And the individual also, if they're going long distance, which happens a lot in this county, also they need to ask for it, but they can be eligible for a meal reimbursement as well. So the max on that is $12 a day for all 3 meals if someone's gone for the full length of the day, and then it's prorated based on, again, time and how long the appointment lasts and how long they're on the road. And then also the brokerage can provide hotel reimbursement at $40 a night, which doesn't take people very far, but it does help in terms of, again, those long stays in Portland or those long stays in Bend. Those in Klamath Falls, I think, are the 3 major areas where people go from this county. So again, and if it's a child and they're going either to Bend or to Portland, the brokerage has an arrangement with Ronald McDonald House, and the Ronald McDonald House accepts the $40 as full payment. So again, there's no cost to the family then as a result of that. So again, if you're dealing with people that have children that have medical issues, it's a really stressful thing to begin with, and then at least the Ronald McDonald House program helps reduce that stress a lot, because again, the individual doesn't have to deal with any kind of payment or reimbursement. Ronald McDonald House bills the brokerage directly, so it reduces some of that stress. Service is basically door to door, so those individuals that need additional help need to bring their own attendant. So the drivers basically just drive it. They don't assist people in getting dressed. They don't take instructions from the doctor and take it back to wherever the person was picked up. They basically, again, are just there to drive. So again, if an individual needs assistance through the appointment process, needs assistance in understanding what's happening, the individual is responsible for bringing someone with them to do that. And there's no extra charge for the transportation to do that. And the children is another issue that people, took the state a number of years to figure out what was the best way to deal with transportation for children. And the state ultimately came down to, if the child is 12 years of age and younger, they must have a responsible adult with them. That's generally a guardian, a parent, a sister or brother that's over the age of 18, that type of assistance. So the transportation providers will not transport someone that's 12 years in age and younger by themselves. So, and that kind of comes into play sometimes with after-school types of things, so again, just be aware of that. And then the drivers don't install car seats or boosters, but again, if the child needs one, then the parent or the guardian is responsible for supplying that. And the driver will, not drive the person if there isn't the appropriate child seat, so, or booster. And the system is set up to where anyone that's using a mobility device can be transported. So again, if you're working with people that use scooters, wheelchairs, that's one reason why I'm really excited about Andrea coming on board. She has really great equipment for that type of thing. They can transport people again that are using wheelchairs, scooters, special equipment. So. And the limitation there is 1 step. So again, the driver can assist with 1 step, but if it's more than 1 step, again, the person needs to bring an attendant that can deal with more than 1 step in a wheelchair. Portable oxygen can be transported, but drivers do not administer it. If someone needs that type of thing, then what we try to do is find an appropriate non-emergent ambulance type trip, and then we can arrange for, again, a qualified, trained individual that can at least monitor what's going on with the oxygen. Though again, can't do anything medical within the transportation world. And seatbelt usage is required for all trips. Drivers will not transport if someone refuses to use the seatbelt. If a person has a Department of Licensing exemption card, then they will not use the seatbelt, but the individual needs to have that in their possession at all times when they're being transported. And that's the only exception to not using seatbelts. And then if there are any complaints or concerns, we encourage you to either contact the brokerage and express those complaints and concerns, or contact me at Eastern Oregon CCO, and we will respond to those as quickly as we can. So I also passed out some information that is very specific to Lake County. Couple of things there. One is, got one that just basically shows all of the counties for Eastern Oregon CCO and how many members in March of 2016 that were enrolled in each county, and then how many one-way trips at least had some connection to your county or whatever county, and shows how many trips occurred during a little over a year's period of time, and basically the rate per 100 members. So it kind of shows what I call market penetration. So Lake County, as you can see, is really low. And I think there's 2 reasons for that. One, again, is just the difficulty of not having transportation within the county. And 2 is we're talking about a county that's really, really large, and there's a lot of distance involved with a lot of the trips here. And I suspect that people are sometimes reluctant to go get medical services just simply because the distance is so far for a lot of people. And that's just a guess on my part. You people probably know much better the barriers that are happening in terms of accessing care in the county, but certainly it's not our best county by any stretch of the imagination.
Well, we take it, we think this is the best county. Let me rephrase that.
Yeah. Or people find their own way there and don't use the system at all, which could be the other case too. So, but again, generally.
But we were, this was the first LCAC group actually came up here And when you were still at the COG, Dan, I collected up data just to answer a couple of questions for people here. But the general awareness of this benefit was at question. I think Charlie raised, how many people that are part of our program really know that it's available to them? The other part is, the Harney would think that they're pretty good too, Charlie, right? Dan, Greg and those folks, and they're just as big as you guys are in their utilization rate, and they get similar distance. So I'm not sure that distance is really at issue. I just wonder,
I think not having a local provider is huge, because generally when we have a local provider, they're also out promoting the program. Simply because when you have a local provider, the Medicaid program actually pays the actual cost of the transportation, whereas the ODOT, when they're providing funding to local public transportation providers, it's providing a portion of the cost. And so the local provider has to find other sources of revenue to make that big picture work for local public transportation. So at least all the local public transportation providers that work with the Medicaid program are enthusiastic about it, because again, it really helps them out a lot, because it helps them get their match for their ODOT grants, and again, it increases their revenue so that they can provide more service. So at least in the counties, Harney is a great example that the county runs the transportation program there, and they're a huge supporter of it, and they really like it, and they tell people that. And somebody calls them and asks for a ride, one of the first questions they're going to ask, are you a member of the CCO? And if that answer is yes, then they run it through the brokerage. Whereas here, she doesn't know, because it doesn't currently have a direct relationship with the program. So,
but there, when you look at the number at 49, per 100 members, it's by far the lowest. And so, if there's any suggestions that you have about how we can promote the utilization of this benefit, that would be great.
that's one of the reasons why I'm doing this road trip, is to make sure that people are aware of the service. And particularly again in a county like this, where again, there hasn't been a lot of usage of the transportation benefit, to make sure people know that it exists. Yes.
I'm just wondering if the 1,810 members, are they scattered throughout the whole county? And if they are, do we have a service that's provided for the straight out of North Lake area? Or is it coming from?
So the trips themselves are distributed fairly equally between North and South Lake County. That's one of the things I've always been interested in. So when I was putting together statistics, at least, I could, get a general idea that they're either coming primarily out of Christmas Valley or out of Lakeview, and the numbers are fairly even. And on the information that I provided you that's specific to Lake County, it's the one with the graphs on the back. The bottom part shows you where people go, and Deschutes, virtually everybody in North Lake County goes to Bend. So you see a fair amount of activity going to Bend. And then I always thought that Klamath was a pretty big destination for South, but the numbers actually tell me it's not. It's really, when you see a lot of the lake numbers, those are primarily people in the South County, and they're primarily staying within the Lakeview area. And then all those other counties basically just are different places people may end up going. And it could be, the Jackson County one, for example, is someone who had a very specific service that they were receiving there and had multiple trips, so that kind of skewed that, because Jackson County is not normally a destination for anybody in the program, period, but we just happened to have someone that lived in Lake County that was getting a very specific service there, and a lot of it, so that's kind of an anomaly. Yes?
Dan, is there any way that you could say these visits that have been, people have used the service, what percentage are for medical, dental, of behavioral health?
I wish I could give you a good answer on that, but one of the things I've noticed in working, the bad news when I was working at the brokerage, I never had time to really dive deep into it, but I have now. And the call takers didn't quite understand the importance of the checking the right type of service on the right request, so mental health, physical health type of an appointment. I find some dialysis appointments coded for behavioral health, so I don't trust the data at all. And so the best I can do is by address, and that's even pretty iffy at times. But and I'm really reluctant to say, but I would say, of course, the bulk is physical health. Anyone that's doing dialysis, of course, that's a biggie, because that's 3 times a week, 2 trips a day. That goes on indefinitely. But I just don't trust the data enough to give you a good answer there. So I'd like to.
And this data set includes the people who requested private mileage reimbursement?
Yes.
So,
Yes.
And you said about half of those?
Yeah, for this
Lake County?
And again, given the size of our population here, at least that uses the service, most of the counties, when I'm doing these charts at the top here, are kind of mirror the bottom chart pretty much in terms of fairly even from month to month. Lake County, again, we've had some really big swings. So that generally usually means to me that somebody's had some kind of serious medical issue that's involved a lot of trips, and then it gets resolved, and then those trips drop off the radar. And it just happens if a couple of months you might have several people with a lot of trips, that skews it pretty highly, just again, because we're not dealing with a lot of numbers here, so there's not a lot of smoothing that would otherwise occur. So we want to do better here, though, as far as at least getting the benefit information out to people. So the other thing that we're working on, and it's at the state right now, is a member guide for transportation. So it's very similar to what I handed out to you, but it's written more from the member's perspective and written at the lowest grade level we could get to, which was about 7th grade in terms of the readability. So once the state approves that, then we'll get this out to everybody too. And it will also be, I think, at some point available on the Eastern Oregon CCO website, because we're also, and a lot of this information should be ultimately on at least Gobi's website. I don't think it is yet, but we're working on that as well. So try to get that information out better. Because the first thing is, if you go to the Eastern Oregon CCO website and look up transportation, there's very little information there. If you don't know the service or the business, you might not have any idea what that means. So hopefully we'll get better on that as well in terms of that type of information. Now I want to shift gears briefly. I want to talk about the rental assistance program. So this is a unique program that the state basically started up about 2.5 years ago. And it's designed to work with individuals who have a serious mental illness and are either transitioning from a state hospital or residential care, or are at risk of being at home, homeless or homeless. And the idea of this program is to provide assistance to those individuals to find market rate housing, provide assistance in going through the process of renting that unit, working with the landlord. Gobi actually pays 70% of the rent to the landlord. So it's an incentive to the landlord to take on a person like this as a tenant, because they know they're going to get their money on a monthly basis. And then we have 2 individuals that work with the renters to help them resolve any of the issues that they might have in terms of the rental experience. So if they're having issues with the landlord, staff will work with them to resolve those. If they're having issues with their neighbors, staff will work with them to resolve those. They'll encourage them to seek any kind of health issues, get those resolved, any behavioral health issues to get those resolved, employment opportunities. We've had some really good success stories with people who have actually found employment once they've gotten a stable living situation and are making enough money that they're no longer eligible for the program. And that is a huge win for us. We are thrilled when that happens. The other goal is to get people onto a Section 8 housing voucher. So again, they have long-term permanent housing if they're not able to find employment. So it's a really good program. There's a waiting list. We do have at least 1 or 2 people in Lake County that are participating in it. And if you know of someone who's potentially be eligible for this or could benefit from this, please get them on the waiting list, because again, there is turnover, and if we can find a slot for someone, we will certainly do that. So again, another program that provides a great deal of benefit to individuals in the community. So, questions on that?
Is the waiting list a first come, first served type thing, or is there
It
a needs?
kind of a combination of first come, first served, plus what's available in the community for rental. So if we have, let's say, I'll use Baker City as an example, we're having a really hard time finding places to rent in Baker City. So we may have a bigger waiting list that basically kind of happens in Baker City because we just can't find a place for someone to rent. So if someone was on the waiting list and they're in another community where we can find a place, we'll fill that slot if we can. So.
And then as far as the non-emergency transport, are there flyers available or posted in providers' offices at this time, making clients aware of?
Not really. McCog has a very simple one, and we kind of, when we first took over the 7 additional counties, we did get some things out to some people, but not broadly. So again, we're trying to work on that at this point. So once we get this writer's guide approved by the state, then we'll have a big push on that.
That might be something that we could do for Lake County, to make sure that people know about it. Because I think there's a lot of people who simply don't know.
And the other thing that's a little different is, and I'll try to say this as correctly as I can, is that the different brokerages have different philosophical approaches to ease of access to service than others. One of the reasons why Eastern Oregon CCO chose McCog to be the broker for the entire CCO was that our approach was more friendly to customers, and we tried to find ways to say yes. And other brokers, and I won't name names, sometimes we'll try to find a way to say no. And so again, our approach when I was at McCog was to be as open to the customer as we could be and try to find any way we could to say yes. And I've certainly gotten a lot of feedback about that over the years, so positive.
So just to put this in context for people, Dan, I mean, when we talk about the social determinants of health, those things that affect health other than the delivery of care, transportation is a piece of it, housing is a big piece, education is a big piece, and food insecurity is another piece of the puzzle. We had food insecurity highlighted at our last meeting. Question for you, because I don't understand where it's going. The waiver process for the CCOs back to the feds this year has a component of housing for CCOs, but I don't understand what it is.
It's not terribly clear yet.
Okay.
So what we're doing right now at GoBe is we have basically a task force, and we're examining all the different types of housing programs that are out there, both state programs, federal programs, programs that involve actually building housing versus programs such as the rental assistance that kind of tackle the problem the other direction. And we don't know which direction we want to go yet, but we are examining that, and then basically we're going to make a presentation to Kevin Campbell as to what he thinks and see then if we can coalesce around a particular strategy. So hopefully whatever strategy that we coalesce around will be one that will work well with the waiver, but also we're looking at some of the additional CCO money as well, because again, that's designed again to improve health and again through the social determinants of health. And one more thing I do want to say, and again, I'm not picking on Andrea, I did visit with her before today, so anything I'm saying right now is not a surprise to her, so. Is that one of the advantages, again, to her program participating ultimately in the Medicaid brokerage is that it increases her revenue, which then increases her ability to provide more hours of rides, drivers, vehicles, fuel, which gets to, again, all those services that the brokerage can't pay for, but again, are social determinants of health. So if someone needs to go to the food bank or needs to get something, you know, some special dietary type of thing that involves a trip to either Lapine or Klamath Falls, and if Andrea's program is healthy and running well, and she's got lots of availability in terms of transportation, people can then access those services that weren't otherwise previously available. So it kind of builds on itself, and that's one of the things, again, in the counties where, again, the brokerage works with the local public transportation providers. There's been a great benefit to the provider and to the community in terms of increased transportation availability. So, and that's a big deal. I mean, the more rural you are, the more difficult transportation becomes. You know, anytime you, let's say, go to the eye doctor and you get your eyes dilated and you want to drive home, and all of a sudden you go, well, how do I get home? Everybody's working that I know, or that type of thing. You know, you all of a sudden will realize what a lot of other people experience on a daily basis is that transportation is very difficult to come by. And the more rural you are, the worse it gets. So. Any more questions, comments?
So really, there was a question in Gillum County when you can't go to a school and pick up a 12-year-old, right?
No. We can go to a school, pick up a 12-year-old with an attendant, an appropriate, you know, relation of some sort, whether it's...
But I mean, a 13-year-old, same thing.
Yes,
Right? Okay.
13
So
would
you
be
couldn't get picked up at school and dropped off at home after you went to your visit?
13-year-old you can.
Oh, could?
Yes.
Okay.
Well, thank you very much. I really appreciate your time and inviting me.
Andrea, without putting you too much on the spot,
Thank you.
does this look like something that you're working towards doing?
Yes.
There's still some barriers?
Not really. We filled out all the paperwork. It's just a matter of kind of reconnecting with Brett and saying, okay, we have the staffing. I was really reluctant to jump in, and I drug my feet for a little while because, A, I wanted to know we had appropriate vehicles and enough of them, because thinking that once people know, this will grow. And
it will.
And I needed drivers. And we finally got to a place where we have nice vehicles, you know, a number of them. We have seven of them countywide. And we have several drivers. We're always looking for yet another. But yeah, it's a go. It's not finalized, but yes.
The reason I ask is with our commissioner here and others, we're all interested in ensuring that this kind of service is available in the community. And if there's anything that we need to do that might preclude you from becoming the designated service center, is there something that we could be thinking about to assist you in that process?
We need training, and the drivers need training.
Are there special kinds of training that they need to get?
Yeah, there's...
And it's kind of tricky to send our crew away when they're driving here, you know, they have a pretty full schedule, so first aid, CPR, the basics, but then
defensive driving and passenger assistance. So basically, when I was still working in the COG, I brought that training to Lakeview. Since I left McCog, the state has stopped supporting the training, so the training setup is a little different now. So McCog's actually doing it, and at least what I'm hearing is they're reluctant to go too far out. More, I think, Hermiston and Ontario and the Dalles is primarily where I believe that they're doing it at this point. So that involves more travel and more time for you too, so.
I can tell you that when you talk about CPR training, for example, that is something that, while we offer that here, and it's been a valuable service, we've been asked to really up our game for the community to provide significantly more service of CPR training. So we're gearing up for that. So that might be something that could benefit you.
And we've been talking with Lisa Pike, and she's connecting us, but then one, the training was full, and then another one, I think the training was at a time that wasn't appropriate for the drivers again, so.
I didn't say it was perfect, but we are working on it. And if there are other kinds of training tools that we need to, if we can help in any way, we need to try and support you in that process.
What's a brown bag full of cash left on a stump? What's really?
You know, since Ginger's in economic development, she'll know
Oh,
where to
sure.
find a brown bag.
Yeah.
Does the fire department do any CPR first aid training here? That's a lot of times a source that a lot of our providers use.
That's what I use in Kurt County, they're real accommodating, you know, with your schedules, so I don't know if that varies from
That's
firehouse to
been
firehouse.
my primary
They're
source is
very
the fire
accommodating.
departments.
Yeah.
Fire departments.
Yeah.
I used to.
And at least my general experience with fire departments for first aid is they'll do it on a Saturday, they'll do it on
Evenings,
evening.
yeah.
They, you know, they'll charge you for it, but it certainly is, they'll make it very available if you can give them a class. I don't know what happens here, but again, most of the counties I've dealt with, fire departments have been really good resource.
Awesome.
How is this program funded then? I think I missed that.
So the transportation is part of the Medicaid benefit. So ultimately, it's a Medicaid service. So a number of years ago, basically, the feds were sued. I mean, most benefits come from somebody suing somebody. And the providing, let's say, healthcare benefits to someone that they can't actually get to was considered to be kind of, well, you're not really providing healthcare benefits because people can't get to them. So I personally worked in the brokerage world since 1993, so it's been around a long time.
Thank you very much, Dan. Yep. Any other questions for Dan or on transportation? If not, John, would you take it away?
Sure.
In the manner.
Okay. I'm John Adams. I'm the director with the Eastern Oregon Healthy Living Alliance, and we're a new nonprofit that was formed by the Eastern Oregon CCO's Regional Community Advisory Council to help improve community health in Eastern Oregon by providing strategies within the regional community health improvement plan. So I've been, we're in the process of going out and doing these outreach presentations with all 12 community advisory councils in Eastern Oregon. So I've been joining Dan, and we've been on kind of a circuit together, and I think he can give my presentation now, and pretty much his pretty much at this point. But we're you know, we want to be able to share our work and be more familiar with what all the community advisory councils are working on, and hopefully identify opportunities where we can work together. So I want to thank you guys for giving me some time to join you and to present here today. I'll be talking about the history and the purpose of the Eastern Oregon Healthy Living Alliance, and also giving updates on our work. Just real quick, I wanted to just provide a brief description about my professional background. I spent I worked over 10 years with nonprofit community organizations. I worked for several years as director for a couple different nonprofit social justice community organizations in the San Francisco Bay Area. Where I had the opportunity to work on a number of different community issues, including community health and healthcare. And as many of you may know, I was also the CHIP coordinator here in Lake County. And initially, so the CHIP program, it's the Community Health Improvement Partnership, and initially it was a program of the Oregon Office of Rural Health, and they partnered with Lake Health District to bring that program here to Lake County. And we partnered with the EOCCO and the Community Advisory Council. So the Lake County CHIP program and the Lake County Community Advisory Council are one and the same. So unique to Lake County, you guys have had a full-time coordinator to support the CAC and to help raise funding for your community health improvement plan strategies and to help provide some programs within the community health improvement plan. Before I get into the history of our new nonprofit, I wanted to just take a look at your community health improvement plan. So this is your CHIP. This is the first one that you guys provided to the Eastern Oregon CCO back in 2014. You can see you got 4 health priorities here: oral health, mental health, physical activity, and senior health. Each bullet under there is a different strategy to address those health priorities. When we were all starting this work and the community advisory councils were forming, and we were working on the health assessments, and we were working on putting this plan together, the big question everybody had was, well, where's the funding going to come from to be able to do all of this? So the Eastern Oregon CCO, they provided every county with some amount of funding to help support CHIP strategies, also to help fund incentive measure projects by your community advisory council and other CAC projects. So my question to you guys is, did you guys receive enough funding from the EOCCO to do everything that you wanted to do within your community health improvement plan? And did you guys feel like EOCCO funding would be enough to sustain your projects over time? What do you guys think?
Well, I can tell you no. That's an easy answer.
All right.
Because the EOCCO doesn't pay anything for senior services. Because it's really designed for younger people.
Can you go to the next slide? So in the first round of funding, the Lake County Community Advisory Council received around $28,000 to support CHIP strategies, implementation, or incentive measure projects, other CAC projects. Certainly not enough funding to do everything that you wanted to do in your community health improvement plan. And this was the case across the board with all 12 counties of the EOCCO. The EOCCO didn't have enough funding to fund 12 counties in all of their community health improvement plans. So can you go to the next slide? If you look across the region, here's all the health priorities that each of the 12 counties prioritized. So if you look at Lake, you got your oral health, mental health, senior health, physical activity. This really relates to obesity and overweight and chronic disease. So I color-coded your guys' health priorities, and you can see that your health priorities are shared with other community advisory councils throughout the region. We all share a number of issues throughout the region. So my question is, if we have all these shared health priorities, and we all lack funding to do everything that we want to do within our community health improvement plans, is there a way that we can be working together throughout the region to raise funding for our shared health priorities? Does that make sense? So that was the question that I was asking myself when I was sitting here at the hospital, struggling to write a grant for our chip projects, knowing that I wasn't the only one and that we were all in the same boat. So one afternoon, I approached Charlie with a proposal around a regional fundraising collaboration, and Charlie supported the idea. In November of 2013, Charlie brought this proposal to the Regional Community Advisory Council, and it was fully supported. In April of 2014, the Regional Community Advisory Council organized a meeting in John Day to develop the guiding principles for a regional fundraising collaboration and to identify regional health priorities. And I want to share with you guys what we came up with that day. Do you mind? Yep. Next. So guiding principle number 1, it says, we fully understand that to be successful, we have to raise funds. Our work is critical to the success of community involvement in improving the health of Eastern Oregonians, and we seek to have a collective impact by coordinating and working together. What does that mean? So I want to, this is an important one, so I want to spend a moment and unpack this statement and provide some context. And the first thing I want to establish is that the work that you all are doing through the community advisory councils is important. Community health improvement is important work. Obviously, we all want to be moving the dial on community health and impacting the lives and the health of individuals within our communities. But community health is also important because it contributes to and it's a part of Oregon health system transformation, which increases our capacity to improve health. For those of you who've been involved with the Community Advisory Council for a while, this may sound familiar to you. For years, the health system has been focused on small incremental changes to make improvements within itself until we realized that we needed a major shift in how we think about approaching and providing health care. Shifting from sick care to prevention, addressing social determinants of health like housing, transportation, and access to food, coordinating and integrating care to care for the whole individual, new payment methodologies that rewards organizations and providers for keeping people healthy, and system navigation to support appropriate use of health services. When former Governor Kitzhaber, when he was promoting health system transformation, he liked to talk about how healthcare should be in the business of providing air conditioners to folks who are susceptible to heat stroke, because the cost of the air conditioner is cheaper than the healthcare costs of heat stroke victims, and it drives down costs within the health system. And he'd give this as an example of how we should be shifting our thinking around new approaches to providing health care. So Governor Kitzhaber, he had a vision and took the initiative, and he was the first governor to negotiate this federal Medicaid waiver and to establish a CCO structure to support health system transformation and to achieve the triple aim. So health system transformation, it increases our capacity to improve health, provide quality of care, and to make it more affordable. Because of my background in community organizing, I believe strongly in community empowerment and giving the community a voice. And the state legislature recognized this need to provide a bottom-up approach, and they required the CCOs to form community advisory councils where diverse groups of stakeholders come together, work together, and develop community health assessments, develop community health improvement plans to impact community health. There's an opportunity for us to work together throughout the region because there is a lack of CCO funding to do everything that we want to do within our community health improvement plans. And it's not only about a lack of CCO funding. There's a lot of other challenges that we face when we try to raise funding for our CHIP strategies. For example, most community advisory councils lack the capacity. They don't have full-time coordinators to raise funding and to write grants for CHIP strategies. Even in Lake County, we were able to raise $360,000 in a year and a half towards our CHIP strategies, and it wasn't enough funding to do everything that we wanted to do. Also, fundraising became really competitive. All of a sudden, in 2013, there's 33 community advisory councils that didn't exist before, all with new projects that require funding. So we're all competing for limited funding to try to do this work. And just as a last kind of point on this principle is, I think that if we're going to be successful around community health improvement in Eastern Oregon, that not only do we need to be working together within the region, but we need to be working with working together within the EOCCO, we need to be working with other organizations outside of the EOCCO. So we need to be partnering with policy, research, academic, and media organizations. And we certainly need to be working with organizations from the private funding community. So businesses, corporations, philanthropy, and foundations. Next slide. Next slide. So I wanted to spend a minute on guiding principle number 1 because I feel like this principle really gets at the heart of the purpose of the Eastern Oregon Healthy Living Alliance. Next slide. So I'm going to quickly go through these other guiding principles. Guiding principle number 2 is really about focusing on a set of regionally agreed upon issues, and I'm going to talk more about those regional issues in a moment. Next slide. Guiding principle 3. So we knew that that we needed to work with a nonprofit organization to be able, so that we could partner with foundations and provide some programming. When we looked throughout the region, we didn't find a nonprofit that had a similar scope and mission as to what we were looking for, and so we knew we needed to create one, and that was really the inception of this new nonprofit, the Eastern Oregon Healthy Living Alliance. Guiding principle 4, this is about appropriate budgeting. So we want to make sure we have adequate funding to do quality programming, and we're not trying to do a $50,000 job with $30,000 in funding. Guiding principle 5, this is an important principle around resource distribution. So we're valuing equitable funding distribution, making sure that everybody gets some of the resources while also taking into account needs based on population and needs based on where the data says there's the greatest need. So also that day in John Day, we spent some time and we went through a process to identify the regional health priorities. This Venn diagram shows the data sets that we looked at to identify those health priorities. So we looked at community data, which includes regional socioeconomics, demographics, health status. It included the results from the household survey that was done here in Lake County and many of the other counties within the EOCCO region. We looked at the health priorities that were prioritized within each 12 counties' community health improvement plans. We looked at the EOCCO transformation plan, which is a larger plan that the EOCCO is required to provide to the Oregon Health Authority. And we looked at region-wide needs, which is really the attitudes, beliefs, and perceptions and priorities of the health priorities of the RCAC members. In August of 2014, the Eastern Oregon Healthy Living Alliance officially formed. I was a founding board member along with President Andrea Fletcher of Morrow County, Dan Brown of Harney County, and Sally Bartlett of Grant County. To emphasize the connection between the Eastern Oregon Healthy Living Alliance and the community advisory councils within the bylaws, it states that the EOLA shall have one member from each county served by the EOCCO to be designated by the community advisory councils. And then Gobi, a major owner within the EOCCO, they wanted to make sure that they want to help support launching this organization and make sure that it was successful. And so they committed to providing the director's salary for the first 3 years of the organization, and I was hired on in September of last year. Since since we've formed and since the board has had a chance to get together and provide some help kind of shape this nonprofit, one thing that there's really an emphasis around is that through this organization, there's an opportunity to really go beyond the Medicaid population, which is really the focus of the EOCCO, and be able to partner with foundations and to bring in that funding and to provide programming to the whole community. So that's kind of the history and background of our organization. Every month we hope to have our board members providing updates. Do you mind just handing this down? I think I have 20, so a couple people might have to share.
John, would it be reasonable to assume that our vendor would be our representative?
Well, I was hoping we'd get to that. We are looking for. So I was the board member initially, and then Mira was the board representative from the Lake County Community Advisory Council. So it's currently vacant. We're looking for a nomination, and so if that's the nomination, then that would be great.
I would recommend that as our vendor gets familiar with all of our CHIP program, our Community Advisory Council, he'll know more about what goes on in Lake County to be a good representative for our community. So I would recommend that you consider that. And I'd be happy to accept, well, John, if you don't mind right now,
Please.
if I would nominate John, our vendor to that position, and would entertain a second.
I'll second it. We're all second.
So I would ask for a motion. Do we appoint our vendor to be our representative to the Eastern Oregon Healthy Alliance?
I moved whenever Charlie said.
Gotcha.
All in favor, please signify by saying aye.
Aye.
Any opposed, same sign. Thank you.
October 5th, you have a board meeting.
Uh-oh.
I wasn't kidding.
I'm gonna kind of, if I could, just kind of cheat off this here. So.
Here's a whole bunch.
Oh, okay. Did everyone? Does anyone else need a copy? Over here, you guys good? All right. Yep. One of the programs is a school-based oral health program. It's the Healthy Happy Smiles program. And our goal is, so this is in partnership with Advantage Dental, and we're providing free dental screenings, fluoride varnish.
So is it varnish or sealants? You keep going back and forth between the two.
Both.
It's both.
Yes. Oral hygiene education and follow up with kids that are identified with urgent dental care needs. We're currently in 4 counties, including Baker, Mount Hero, Harney, and Grant County. We have 21 schools signed up, and that equates to around 2,600 students. And there's a couple more schools that are interested in joining on with us. We've been able to begin providing some of the services. So Mindy's been out in Harney County and has started providing some of those services. So we're excited to be at this point where we can finally, start making that impact. So for mental health first aid, we are so this is we received a grant through the Oregon Health Authority, and this grant helps us to provide 12 trainings throughout the region. We're targeting providing the training to teachers and law enforcement officers throughout the region. And we've got a number of schools and school districts signed up, and some law enforcement. So we have schools and school districts in Umatilla, Morrow. We talked with Will, and there's some support around providing that here in Lake County. Also Wheeler and Grant counties, and law enforcement in Union and Harney counties. So the trainings, we're starting to schedule more trainings. There's 2 in Umatilla County that are happening on Friday. There's the 2 here in Morrow County that are scheduled, and Grant and Wheeler counties are scheduled for October. So I'll be interested in following up with Will and his staff on getting that training scheduled out here in Lake County. Part of the grant program is that we have resources set aside to help support schools and help support law enforcement. So if they need to bring on substitute teachers, or they need to bring on reserve officers so that their staff can participate in those trainings, we have some funding set aside for that. And then finally, for the colon cancer screening program, we received some funding through the OHS Unite Cancer Institute to provide focus groups in 5 counties in Eastern Oregon, including Lake, Harney, Gilliam, Sherman, and Wheeler. And through the focus groups, we wanted to identify best practices for reaching out to the community and getting more folks to participate in colon cancer screenings. And so we've been able to look at the themes from those focus groups, and we're working on finalizing our report. I think there's 5 main takeaways that we're really looking at right now. One is that there was really misinformation throughout all of the focus groups. So when Paul was facilitating those and he was asking questions about their knowledge, there was just kind of answers across the board about what people thought about colon cancer screenings. Just anecdotally, here in Lake County, one of the people who attended the focus group learned some information, and she went and got checked out, and they found something, and they were able to get it removed. So we were able to help somebody out there, and that's really what this program's about, is really wanting to educate more people, get folks out there to get screened, so that we could prevent long-term illness and death.
John, if I could, just when you're running a focus group, you're supposed to be getting information from people and not telling them things. And I recognize that I was violating the principle there, but I couldn't let people walk out of that room not knowing how long a colonoscopy was good for, or if they did the fecal test that you had to do it annually, that if you had blood in your stool, some of them believed that meant you had cancer. There was just a lot of unknowns about flexible sigmoidoscopy. I mean, so I just couldn't just let people go. And so that was a little bit of a violation, but it was. I mean, there was even somebody who said, it's on TV, you can get a DNA test. You could pay for a test over the TV. I mean, we need to do a great deal of education about what types of colon cancer screenings are available, how long they're good for, how frequent you need to have them. Sorry, John.
Oh yeah, no problem, appreciate that. So I'm not going to go through all of these, but I can tell you that they had a lot of recommendations in terms of the materials that we used, and making sure that we're including some statistics and the risk factors, and really keeping the content kind of short and concise, and limiting the overall content so folks aren't overwhelmed. There was a lot of obstacles that people talked about in terms of just the yuck factor that people associate with colon cancer screenings, and other barriers. And then another takeaway was around just really wanting to work with the clinics, that folks would be more apt to respond if they received a letter from their clinic versus someone else. And so those were some of the key kind of messages and takeaways that we that we captured from the report. And I mentioned last time when we were here that we were working on a renewal grant, and that was due just a few days ago, and I was able to submit that renewal grant, and so it's based around these findings, and the proposal has three main components. So first of all, we want to partner with community advisory councils to provide, to be able to outreach to the community and try to promote the colon cancer screenings. So the three components is an education piece that has to start with education. So much information was out there; it's kind of comical reading through the transcripts and some of the responses that are out there. And so starting with education, wanting to have an outreach piece and doing outreach presentations. If we can have testimony along with those outreach presentations where some respected folks in the community can talk about their experience and make it more real, that's a powerful way to connect with people, and that came across through the focus groups. Number two would be organizing an event using Nolan the colon. And so which county used Nolan the colon?
Just recently, Baker had 164 people show up, but Harney used it.
So Harney and Baker County, and so it's a giant inflatable colon that you walk through, and it's
People were taking selfies with colons.
And it's educational, and so wanting to have that at an event. So I could see, if we worked with the Lake County Community Advisory Council, trying to work with the folks organizing the daily days and trying to get that here in a table and booth, and talking about colon cancer. And then the final piece is clinic outreach, and so partnering with the clinics to try to do a direct mail letter to all of the folks who are in the target population, which is 50 to 75, and giving some educational information, but promoting and encouraging folks to come in and to provide the screenings, and doing a follow-up. So that was a key message that came out of the focus groups is having someone associated with the clinic call up. Did you receive the letter? When are you going? What do you need help getting there? Do you understand the instructions? How can I help you? All that kind of thing. So that's what our proposal is based on. We're interested in partnering with four counties or 4 community advisory councils to provide that. So if that's something that you guys are interested in, we'd love to partner with you guys. We are asking every community advisory council that participates. So the EOCCO is they're similar to prior years. That they'll be allocating funding for CAC projects and for projects to impact the incentive measures. And so we're asking that CACs that participate, that they use $2,000 of that funding that they receive from the EOCCO towards this project. Any questions, you guys?
How soon do we need to respond to you about whether we want to participate?
Well, we'll know at the, yeah, exactly. We'll know by the end of November if we receive the funding.
So we have a little bit of time to think about it.
Yes.
Excellent. Other questions for John or issues? Thank you, John. Appreciate it.
Yep. Thanks, guys.
Thank you, John.
Got a couple things that I'd like to ask us to do, because we only have about 15 minutes left. First off, I think you should know that the fact that we have, as a district hospital, we've invested a lot of money in our community in terms of our health needs. We started out working with John. We really have been promoting this Eastern Oregon Alliance. We have been one of the few counties that has had a full-time CHIP coordinator. That's not something that all the other counties have done. One of the reasons why we've done that, and we're gonna continue to do that, is while we have a great county, we have a lot of people that have a lot of pathology. Our scores are not as good as other communities. And we need to change those things. And we need to take that very seriously, because it's a serious matter for our community. And that's why we are investing in our, in the resources that we are providing. We have a lot to do. You have a very important role. So what I thought I would like to ask, and granted we've brought on 3 people relatively new here, so some barely even this week. So if you could start off by, we'll start with you, Christy, because you're on my immediate right. Then we'll go to you, Rochelle, and then we'll go to Arvinder. What I'd like is if you could talk a little bit about your background, a little bit about who you are, and what you hope to accomplish this coming year, knowing that this is the first meeting that you've been to. And for some cases, Arvinder barely been here a couple of days. A little bit about what you think we might be able to do in the coming year.
All right, well, I've been here 5 minutes, 2 weeks at the hospital today. Background-wise, I was born and raised in Lakeview. I was born in this hospital. Beth drove me to my very first high school dance. My training is all in journalism. After graduating here, I ended up graduating from the University of Montana. My degree is journalism. I've spent 10+ years in that profession. So the writing piece is what I have down and what I want to bring to the grant writing piece. I love Lakeview. I'm so excited that I have a chance to be back here and to give back to this community that raised me. And I guess that's for me on a personal level what I want to bring the writing skills for, is to be able to use those to explain to the people who have the money why we need the money and why they should give us the money. As far as needs, I'm still learning that, as you know. Learning all about healthcare, learning about this hospital. On the immediate horizon, John, I think, mentioned the dental, the school-based oral health program, you and Will, to talk about that school-based program, just to try to get caught up. We have an opportunity to renew the funding for that program for a 3rd year. That proposal is due in about a month, so very soon I'll need to talk to you guys. Our vendor and I are going to be working pretty closely together as we both figure out what the heck is going on. There are a lot of opportunities through this group, through the CHIP, to get funding into the hospital. If anybody has ideas, please email me, call me, tell me what
is your name
for.
again?
It's Christine Albertson.
Oh.
One of the many.
That's a strange name.
And yes,
there.
And what's your extension?
398.
Thank you. 398?
398.
Okay, thank you.
Right, so my name is Rochelle Hanson. I'm the Food Corps service member here in Lakeview, Lake County. A little bit about my background. I just graduated this past May from Lewis and Clark College in Portland, Oregon. I was an anthropology major there, as well as sociology. So some background in kind of community engagement and looking to work with people from different backgrounds, different cultures, different perspectives, which I think will serve me well here. I grew up in California, so a bit of a different, different lifestyle. And so yeah, I'm here to learn so much about this community, what's important to the folks out here, and just how to work together across those lines of sometimes what can be different, but yeah, where the similarities are. Specifically, what my role kind of encompasses is hands-on education, so working in classrooms, providing nutrition-based and garden-based lessons to children. We're working primarily in Union Elementary School, Lakeview High School, and then A.D. Hay, Fremont Elementary School. So definitely my goals in terms of working with CHIP. I know that the fourth health goal was around physical activity, correct? And then I believe even the fifth that didn't quite make it on there was in regards to like nutritional health or like food access and that kind of thing. And I know, yeah, kind of piggybacking off of what Emmy was doing with the food system assessment that she was doing this past year. So yeah, just looking to really start with the base of the youth here in this community to teach them about, you know, where food comes from, how it's grown, you know, just like fundamentals of that nature, and then how to cook it in a way that's good for you, in a way that's going to kind of nourish your body, and also, you know, protect the environment, sustainable way there. So, yeah, I guess just working with really the youth is kind of my piece, and just like engaging with the future of this community, and just, you know, hoping that they'll have the most healthy lifestyle as possible.
Excellent, thank you very much.
What's your name again?
Rochelle.
Rochelle? Thank you.
Arvind?
Once again, my name is Arvinder Singh. You can call me Singh because I guess it's more easier to pronounce. I've had a background in dentistry. I've practiced as a dentist for 2 years in India. And I graduated just summer of 2016. I was doing my double master's in Masters in Public Health and an MBA. And Charlie has been very supportive to me transitioning into the CHIP coordinator position. And I'm aware that the previous CHIP coordinator position, the people who are working did not have the support. Like, I have a new grant writer with me now. And also Paul McGuinness has given me a very good idea of what the responsibilities demand. And I'm gonna bother you a lot, John. Yeah, and I'm really invested in the goals of what a CHIP coordinator is supposed to do, the physical health, mental health, senior services, and I hope to better them. And yeah, very excited to be here and work with all of you.
Excellent.
I'm glad you're here too.
Do we have anyone that wants to make a comment about what their department or their field interest, where it's moving? Any issues that we need to be, we're ready for doing kids, is that right?
What was that?
Are we ready to do the dental sealant for all the kids?
We are. We're going to screen the elementary schools in November, 8th and 9th conferences. We don't have a date scheduled for the middle school yet, but those, it's sounding like Mr. Hamilton is going to let us do those during school hours. So we'll get going on those, and there's sealants and whatnot. And then as far as the rest of Lake County, I've got dates scheduled with Paisley, North Lake, Flush and Adele are getting back to me. Anyways, we're up and rolling, I got the dates going, and North Lake, yeah, so I'm scheduled.
I had to leave the room for a minute, and I apologize for that. How are your signups, Mindy?
Pretty good. I'm hoping we'll still get some more that get turned in, but good.
What kind of percentage of the population of kids do you think we'll be able to hit?
As many as turn in forms. So most kids turned in forms during registrations, or most parents, but there are some that either the forms weren't filled out correctly, forgot a signature, that type of thing. Those we need to follow up on. Again, since the screenings won't take place and the services won't take place until November, we have a chance to kind of redistribute to the students that we did not get a form back from. And what we'll do there is basically just distribute to those students, so we're not sending out mass amounts of consents, confusing people, that kind of thing. But hopefully as many as we can, hopefully we get a good turnout, and hopefully it'll go well.
Consent is good for 2 years, correct?
Correct.
Thank you.
Yep, 2 years.
Maybe one of the things that we could do is, with the support of the paper and the local media, tell the public about this, kind of like a PSA.
And Susan Warner suggested that, and so she had given me a couple names that I don't have in front of me about people to contact, so more information on that would be great. I see I'm not right here in town. So all for recommendations on that, suggestions as far as radio, TV, the flash ads, that type of thing, definitely.
We might be able to see if Jimmy, we might get some on the Wise Buys for a couple of weeks or something like that. That's you.
That's advertising.
Okay, well,
Mindy, call me.
so the more that we get people aware of this,
Yeah.
so that they sign up, it really does have a huge impact on the future of our kids' team.
And kind of word of mouth as other, it's kind of the domino effect, oh, you signed up for it, okay, I'll sign my kids up for it, oh, that year it's, long story short, if parents have said no for whatever reason or didn't turn a form in, they can definitely change their mind and say, you know what, I do want to participate, I do want to do that. And so again, we'll put a blurb in like the school newsletter and whatnot, reminding the services, reminding families that services are coming and that, permission forms available, consent forms available, if you haven't signed up, if you want to sign up, whatnot. So people can change their mind if they said no for whatever reason or just didn't turn in a form. Definitely encourage them to pick up a form, get it turned in.
Awesome. Beth, do you have anything that you'd like to update us on? Anything new or special?
Nothing new, no.
Okay. Commissioner Kestner?
Nothing to update. I'm kind of preoccupied with trying to get internet out to Warner Valley and Surprise Valley, which would aid in education and health also.
Well, we're a little bit ahead of being on schedule, so thank you very much, everyone, for your participation. Our next meeting is in October. I believe the date is October 13th. So we can mark calendars on that.
And as reflected in last month's minutes, we hope that the board will have decided what the distribution of funds will look like by then.
I think the board meeting is going to be on
27th.
of this month, so
Yes.
2 weeks. So we should have. Thank you, everyone. Thank you for
The normal blanket, more just a little.
Yes, ma'am.